Oh, but now they hear news. They say if you go LUTH, you know LUTH now, Lagos University Teaching Hospital. If you go LUTH right now for Surulere, many of the wards don't close down. And many beds there in that ward. If you go there and say you know where, there's a high probability for them to tell you, say, bed not there to treat you. And beds there. The problem is that they don't have doctors. The doctors who they care for there, we're supposed to take care of sick people. Many of them don't japa. Nurses, they japa. So there are not enough people to take care of Nigerians. So the wards are closing down and they have bed spaces that nobody can use. Let me show you. The House of Representatives Committee on Health on Tuesday raised concerns over the decline in the country's health manpower. The committee disclosed that due to the relocation of doctors and nurses from the Lagos University Teaching Hospital LUTH to various parts of the world, 5 wards comprising 150 beds have been shut down. LUTH is Nigeria's premier health training institution. Chairman of the committee, Dr. Amos Magaji, described the situation as worrisome, saying the legislative arm is working towards nipping the increasing rates of Nigerians going abroad for medical tourism in the bud. He said the Nigerian health workers' migration overseas has taken a huge toll on the country's health system, affirming that the Japa syndrome will be curtailed by building state-of-the-art infrastructure and making the sector attractive and rewarding to workers irrespective of their fields. Speaking during an oversight visit to LUTH, Idiaraba, the health committee chairman reiterated that Nigeria as a nation has found itself in a precarious moment, especially in the healthcare system, where Japa has taken center stage. We used to have Japa only for nurses and doctors, but now it has even gone to many departments in the health sector. We saw significant problems here. Right now, there are about 5 wards in LUTH, totaling about 150 beds that have been shut down because there are no nurses and doctors to work in those wards. And these are as a result of the Japa syndrome we are having. As a committee, we will work together with the federal government and also with the teaching hospital to find a way out of these national embarrassments that have been following the country. It's not something that can be fixed in one day, but nevertheless, we are going to be approaching it piecemeal. We are going to do what we can to immediately and what we can to do long-term approach to do it. So by the grace of God, some of the issues of the Japa, we are actually looking at how to solve this problem, starting even from the enrollment in universities and then how house officers are employed, and then of course the residency program. They have sacrificed so much for Nigerians to be healthy, for us to get proper health care. Our hands are on deck, and then that was the reason why, if you were a year earlier, you discovered that some of the key questions and some of the key things we attended to here were things that have to do with delivering affordable and accessible health care to Nigerians. Meanwhile, Chief Medical Director of LUTH, Professor Wasiu Adeyemo, told the lawmakers that the Cancer Center of the University Teaching Hospital has treated over 9,600 patients since it was commissioned by former President Muhammadu Buhari in 2019. Professor Adeyemo added that citizens of other countries in Europe, Africa, and America now visit the center for treatment and urged Nigerians to patronize the facility, just as he commended the federal government and the House of Rep for supporting LUTH, for the support LUTH enjoys in providing quality healthcare for Nigerians. You see, I've always maintained it is good to provide affordable healthcare for Nigerians, but it's also good to take care of the bird that lays the golden egg. Somebody know go school for 7 years, do housemanship, find work, or be doctor. You got to pay at 250,000, 300,000. Meanwhile, what act the way one for election, we also got a collect contract of millions. A full-blown doctor, not go fit buy better motor, and your boys the ball. Chairman of local government, they cash out. Councillors are doing well. No need to say, see, it is beautiful. I like the way it said they would nip it in the bud by building state-of-the-art hospitals and infrastructure, but also give us state-of-the-art welfare for our doctors and nurses. You see this opportunity what European countries gave or what I give to doctors, nurses, health workers, when made at the Japa, if they give that very opportunity to military men, oh, now not go sleep for an army. If they give the opportunity to lecturers and teachers, your schools will be empty. If we continue paying skilled workers, hard workers peanuts, and we continue buying cars for House of Rep members with over 100 millions, people will keep jacking. The people will do the jacka safe. Don't be saying that they do well for the youth, but their security is assured. So give us basic amenities. That's what Nigerians are asking for. Take care of the people that work for you. Basic amenities. Let their children be able to go to school without them suffering. Let healthcare not be their problem. People who they teach for Nigerian schools cannot afford to send their children to the schools they are working. These people, oh God, healthcare, police, military, they should be worshipped in Nigeria. But they are living like peasants. And you expect them not to Japa. We'll keep complaining. They're going to lock more words too. Let's tell ourselves the truth. Many of us, when you see the worker for Nigeria, they have visa with the wait. Now, anybody you see for this country is either they never give a visa or ensure the problem of the country. Now make it a wait. Now, very few of us still here because we believe in this country. The truth is, we don't believe in the country. The way the country they go, there's no more hope. The small hope we won't get for the last election before, now they collect from us. So people better do the right thing in government. Meanwhile, one of our guy, Coach Ben, they do affiliate marketing courses. They teach people how to do affiliate marketing. I've said it many times that there's a lot of money in that industry. So please, you can join his courses, learn how to do affiliate marketing. You can make thousands of dollars every month from sitting in your house, and all you need is a phone. Please, my number on the screen, so Mona message him, he go show now. Mona advert, oh.